Hi, everybody. Thanks for your time today. My name is Lynn Marble. I own Phoenix Health and Life Insurance. I'm the principal. And my goal here today is to give you some information about what's going to happen in this upcoming 2025 annual enrollment. As I'm speaking to you today, I'm speaking to my Medicare beneficiaries, my Medicare clients. I'm also speaking on behalf of some of my agents who are in our organizations or associate agents and those clients who are watching this video today. So our goal is to be able to give you some insight about what we expect to happen for 2025. This is the year that we're calling 2025, the year of Medicare disruption. So we have some good news and we have some bad news. So let me share what's happening with everybody. And I appreciate your time in checking this out. So long story short, what's happening is we've got three different factors that are going to contribute to some of the changes that we expect for this upcoming 2025. And, for the last 15, 16 years, I've had the luxury of being able to give my clients nothing but good news for the most part. Better copays, no referrals, wider networks, dental benefits, vision, et cetera, et cetera. And with all of these changes every year, the market has been extremely competitive, and it's been nothing but good news for the most part going forward for the last 15 years. Well, we expect this year to have some changes, and you need to understand why and what's going on. So, number one, we have three different factors that are contributing to these changes, okay? Number one is we have higher utilization than we've seen in a long, long time. So more people are going to the doctor post-COVID. We have higher medical inflation costs than we've ever seen before. And so for that reason alone, that's going to contribute to quite a bit. Number two, the carriers, the insurance companies, United Healthcares and Blues and Cignas of the world, they're going to be funded with not as much as they've seen in the past. So I'm not going to sit here and cry about how much the insurance companies are getting or not getting, but the reality is they are businesses and they're not going to be funded. They're going to be underfunded slightly this year. So for those two reasons, that's going to be contributing factors. Number three, and this is a big one, is we're going to have some changes in the Part D prescription drug plans and how they operate this year. For those of you who want to understand the old-fashioned donut hole, where after you spent roughly $5,000 worth of drugs, and then you had to spend 25% coinsurance for the repriced amount of your drugs until you hit $8,000. That's going to be going away in 2025. So what you're going to see is a completely different model, whereas we have a cap of $2,000 that any beneficiary can possibly pay over the course of a year. So for those folks who are using high dollar drugs such as Eliquis and Ozempic and some of these other higher prescription drug plans or costs, what we're going to see is, for those folks, hey, this could be a good thing for you, right? If you're spending $8,000, $10,000 a year worth of drugs or more, then capping out at $2,000 is going to be a good thing for many of our members, right? But for everybody else who's not using a lot of high dollar drugs or spending over $2,000 a year worth of drugs, what's going to happen is you're going to see that your other benefits get pulled back because this cost needs to be shared by the entire pool, right? And that's how insurance works. So for these three reasons, we're going to have some significant changes in underfunding, overutilization, and more financial burden being put on the insurance carriers through the Part D prescription drug changes that's recently been brought on. So for all three of these reasons, I'm creating this video to let people know that this is probably going to be the first year that you see your benefits pull back a little bit. Now, is it Chicken Little, the sky is falling? No, I really don't believe that. I think that your plans are going to be still super rich and very, very benefit oriented, and you're going to have superior plans to what people in the under 65 market have or even have close access to. So I really don't think that the market is going to allow for everybody to be able to pull back so significantly that your plans look bad. I think your plans are still going to be super rich and very good. But I do expect to see some pullback. And why are we saying this? Because, for the first time, we're going to see everybody's plans take a step back. So I expect to see some deductibles that we haven't seen before on prescription drug benefits. I expect to see some premiums on PPOs plans, especially that we haven't seen before, or maybe higher premiums. I also expect to see some possibly higher copays. Maybe a little bit less dental benefits, maybe a little bit less transportation, maybe a little bit less vision than what you're currently used to this year. Now, can we get into specifics? No, we can't. We're legally not allowed to give you any specific information on benefits until October 1st. But what I want to coach you on right now in this video is by September 29th, you have to receive from your carrier what's called an ANOC letter, an annual notice of change. That letter is going to specifically detail the differences between 2025 and what you're currently getting in 2024. Now, for many of you, you're going to probably go, hey, do I need to shop, right? That question's going to come across. And I want you to know that Phoenix Health and Life Insurance, Lynn Marble, or any of our associate agents that you happen to be attached to, okay, are your agent of record. Now, I'm making this as a point because we know that the Joe Namaths of the world and the all these Medicare commercials that are on every 5 seconds, these are call centers. These are outbound, inbound call centers that are going to skirt around the rules, even though they've redesigned some of these rules in probably a non-compliant way. And that's why your phone rings. And some of these people are even saying that they're from the carrier, and they're not from the carrier. They're not from Cigna. They're not from United. Nobody's outbound cold calling you from Humana. That's not happening, okay? So what's happening, though, is we're getting call centers that are reaching out to our clients. They're trying to switch to anything that they can, and they'll tell you whatever you want to hear. We want to take care of our client. Sometimes that's going to mean that you stay in the plan that you're in because that's where your doctors, your prescriptions are covered the best. That's where the network fits you the best. But sometimes we're going to have to make a recommendation. This might be one of those years where we maybe need to move you, right? So we're going to hold some webinars on every starting in October, and we're going to be sending out some letters or some postcards with some dates of those so that you can register for those webinars and get a feel for what your plan is going to look like in 2025 so that you have a good idea about, do I need to shop? Is this something that I'm going to be, drastically affected by or not? So we want to give you this message and basically just say, hey, we are your agent. We need you to please stay with us. Okay, we are a family-owned agency. We're a family-run business. We pick up the phone. So if you need to call us at 623-516-8300, what you're going to find is that a human being answers that phone, not a teleprompter, not a computer. We're very unique in that form. We really specialize in our customer service, and we really try and take care of our clients and do the right thing for them and make sure that you get the best coverage possible. This year, we think that there's going to be some opportunities to help cover those gaps with some other products that might arise. So, we may need to schedule a meeting, or we may just direct you to one of the webinars that we're going to be putting on. So please look for that future communication. Here we are in June, just trying to let you know what's happening for the upcoming 2025. So I appreciate your time. I hope this gives you some information about what's going on. And we just want to let you know that we're going to be here for you. We're going to have a good strategy. We're going to help make sure that you have the best possible coverage that you deserve. Thanks so much for your time. We appreciate it. Take care.